Performing a Hydrabrasion treatment. When your teeth need cleaning, you go to the dentist. When your car is dirty, it gets washed. When your carpets are dirty, you have them professionally cleaned. What about your skin? Most microdermabrasion treatments deeply exfoliate the skin, but do not deeply wash it. Hydrabrasion is a deep cleaning skin treatment. Performing a standard microdermabrasion treatment ensures dead skin is thoroughly removed topically. But what about the dirt, makeup, sunblock, and oil deep down inside the pore? Removing any plugs that sit in the pore means that you can wash the skin deeply. The Hydrabrasion has two components, a dry and wet exfoliation. Hydrabrasion works with a dry exfoliation first to vacuum any plugs in the pores. Once the plugs in the pores have been cleared, we change over to the wet Hydrabrasion water system, which will wash the skin. And this is where Hydrabrasion is unique. We guarantee the cleanest skin ever. So always start with the dry exfoliation. There are two variables when performing this treatment: the tip grade and the suction strength. To begin, let's choose a white tip for both dry and wet. Take a wet white tip and attach it. Take a dry white tip and attach it. For your very first treatment, commence with the suction at 3/4. With 3/4 suction, the risk of bruising the client is low. Once confident, you will always treat with full suction and usually a white or yellow tip. Also, you will be required to fill the clean water canister with water. Microdermabrasion is like driving. The most important thing is learning how to stop, or in this case, learning how to remove the tip off the skin so you don't injure the client. Dropping the tip on an angle will break the suction instead of pulling it off the skin. When approaching each client, we suggest you visualize dividing the face into two halves. In each half, divide the skin into sections. Section 1 is the forehead. Section 2, the outside cheeks. Section 3, the chin. Section 4 is the lower cheeks and lips. Section 5, the upper cheeks and the nose. Finish one side before starting on the other. The final area is Section 6, the eyes. Let's begin. You will treat every section of the face in all 4 directions. Treat the forehead in a horizontal direction. Treat the forehead in a vertical direction. Treat the forehead in a diagonal direction. Treat the forehead in the opposite diagonal direction. To ensure you are getting full suction, make sure the diamond tip has completely gripped the skin before you move. If you have not closed off the suction, you will hear air escaping. Make sure you have full contact on the face. Ensure firm pressure of the tip. Don't just push down. This treatment needs your ears too, not just your eyes. Can you hear any air, or can you hear the motor building up in pressure? The longer the suction remains, the more intensive the treatment becomes. This is what is happening inside the machine. You must let the pressure build, so ensure you have closed the suction before moving. As you become more confident, you might like to increase the suction and also the grade of the tip. A white tip has 50 microns and is considered fine or light. A yellow tip has 75 microns and gives a medium exfoliation. An orange tip has 100 microns and gives a deep and rough exfoliation treatment. It is often asked, how many passes do you do on each area? The answer: there is no set amount. As the operator, you are in control of how deep or how light you go. It is important to know what endpoint you are planning to achieve and what each endpoint looks like. Remember, the intention of microdermabrasion is to remove the dead skin. You can see the dead skin being removed. You will need to look closely though. It will look like a fine white powder in appearance. Once the majority of dead skin comes away, then this signals an endpoint. Because the treatment is attached to a vacuum, erythema is normal. The skin will become flushed, but this in no way means your endpoint. The flushing and redness is simply blood coming to the area. An increase of blood isn't the same as dead skin being removed. So let's go over your endpoints. Endpoint 1. Softness. If a client has a very special event that evening and they want to ensure their skin is perfect without any risks, then the treatment is a soft treatment. Feel the skin and see how it feels. Is it soft to the touch? This endpoint is usually achieved around 20 to 30 passes. Endpoint 2. Open pores. Removing the contents of the pores gives a visual of the pore being more open. Once oils fill the pore again, this will look closed. In most treatments, you will exfoliate each area until the pores look open. This endpoint is usually achieved around 30 to 60 passes. Endpoint 3. Microtrauma. Microtrauma is not bad. It is simply pushing the skin and giving the client an extreme treatment. This occurs if you exceed 60 passes. Microtrauma is visible when little blood marks appear under the skin. It's not blood on the surface, it's simply blood under the skin. If you touch it, blood isn't transferred. You can comfortably and safely push the client's skin to this point without permanently damaging the skin. Microtrauma will remain on the skin for 24-48 hours. After completing the face, remember to come back to treat the eyes and lip. and we will treat the eyes very delicately, so let's reduce the suction to just below 1/2 for under the eyes. The technique should look like this. Treat the top lip. Increase the suction back to around 3/4. Let's now show you some various techniques to intensify the treatment, especially when treating thick skin. The dry exfoliation has 3 different techniques. 1. A single direction. We recommend performing this technique mostly. 2. A back and forth technique. A back and forth technique is usually used for much thicker skin. If the skin is thick and you are performing too many passes, then increase the dry diamond tip from a white to a yellow. 3. An erasing technique. If plenty of skin is being removed, then you can perform an erasing technique. When treating cheeks, if the skin is sensitive, especially if a client appears to have dilated or broken capillaries, then reduce the suction. The treatment will not damage the skin or cause dilated capillaries. However, having a strong suction increases the blood flow to the surface and can make the capillaries more noticeable. We recommend turning the suction down to 1/2 to 3/4. Keep in mind the second component, the wet hydroabrasion, exfoliates further too. So we suggest to slightly undertreat, as double exfoliation may be too much for some. After you have finished the dry treatment, switch the machine from a dry to a wet. You do not need to turn the machine off, keep it on. Reduce the suction. If the suction is too high, the diamond tip won't glide over the skin, it will grip too much. If the suction is too low, the water won't flow, so it's a delicate balance. Usually the suction should be around 1/2 to 3/4 strength. The water component is a very unique feature. Water will only flow once the seal is closed. The water can take a few seconds to reach the diamond tip. Once the water has reached the diamond tip, then you can begin to glide the tip over the skin. The technique differs to a dry system where we only have one technique. The wet treatment is performed at a slow and deliberate pace. Start on the forehead and move towards the eyes. You may need to push the skin together to get better suction, especially if the forehead is quite bony. It may be a little tricky to get water flowing if you don't get full suction, so take your time. The correct technique here is to let the tip glide over and parallel to the skin. Make sure the diamond tip closes and seals. Pause intentionally. You will be able to hear it if the seal isn't closed. The technique is just one pass all over the skin. You can slightly overlap each pass. Move in the flow of the lymphatic system as much as you can. Your technique should glide for a few centimeters, pass, and break suction. Resume immediately and continue in the same direction. When treating the nose, we support the nose and move the diamond tip in a small circular motion. Because the suction is too strong with the wet treatment, we suggest avoiding the eyes. After the treatment, finish with non-active serums and an SPF. Don't forget to show the client the dirty water. Compare the clean water to the dirty water. You can perform this treatment every week or fortnight for a heavily congested skin until you've cleared it completely. Then you can maintain the results every 4 to 6 weeks. For all skin types, treat monthly. Let your client know that once they break out again or they are feeling congested, it's time for another Hydrabrasion treatment.